Today we're going to do part 2 of the What Is series. So today we're going to do what is PCOS. Alright, so PCOS, I got some notes because I never want to provide you with the wrong information. Today's information is coming from the Department of Health and Human Services. So PCOS stands for polycystic ovarian syndrome. Now, when I was diagnosed with this, I was like, do I have cysts? What is happening? She told me that there is a two forms pretty much. So a form that does have cysts and one that do not. I do not have cysts. However, my blood test that was completed did show that I did have PCOS, and that is something that we're going to cover. So first I want to go over some basic information. So one out of every 10 women will suffer with PCOS, and that's within childbearing years, so 15 to 44-ish. Of course, those numbers can vary depending on the person and the culture. The side effects, or the symptoms, I should say the symptoms of PCOS are hair growth, acne, hair thinning, weight gain, dark circles, skin tag, and irregular menstrual cycles. And so, of course, women might be dealing with these kind of things, but when you have a combination of them along with the causes, you will be diagnosed with PCOS. So the causes of PCOS are high levels of androgens and high insulin levels. So androgens are a male hormone, but females have them too. When your androgens are high, it prevents you from ovulating, and it causes that growth, that hair growth and that acne. With the insulin, you end up, most of the time when individuals have PCOS, they end up with insulin resistance, which in the long run can cause type 2 diabetes. Let's see, it's saying insulin resistance are high in those who are overweight, eat unhealthily, and don't get enough exercise. So it's something that can be diagnosed a couple of different ways. That is through a blood test, one through a pelvic exam, a physical exam, and a sonogram. So with the blood test, they're testing for the androgens and the insulin, and then the physical test, they'll check your blood pressure. They'll look at the extra hair on your face, chest, back. They'll also look at the skin decoloration, and so a lot of my skin discoloration is on my neck, and so when I have a combination, I try to stay within the same group, therefore my doctors can see each other's notes, and when they compared the notes along with my blood test, they did decide to diagnose me with PCOS. Now, there is no treatment there is no cure for PCOS, but there is a lot of ways that you can treat it. They're saying through birth control, hormonal birth control, so the ones that have birth control, metformin, which is an insulin kind of drug, and then anti-androgen medicine. Now, the anti-androgen medicine is not FDA approved, therefore in America they really don't like to prescribe it. Now, I can tell you personally, I am on the metformin. It has helped greatly. You can check out my video, I'll icon it above, when I talk about my medications and how the metformin has really helped me. As far as my PCOS, it has gotten better, and I'm going to talk about that in another video, about how I have gotten my PCOS to lower. I can't, like, I believe you can eventually, like, almost have no symptoms, but it does require a lifestyle change, and that is something that I will cover in another video. This one I went through pretty quickly about PCOS, but if you have any questions or you want me to go into things a little deeper, leave a comment below and I can definitely do that for you guys. Until then, keep pushing.